This is Lab Medicine Rounds, a curated podcast for physicians, laboratory professionals, and students. I'm your host, Justin Kreuter, a transfusion medicine pathologist and assistant professor of laboratory medicine and pathology at Mayo Clinic. Today, we're rounding with Mr. Bob Jackson, an instructor in laboratory medicine pathology here at Mayo Clinic, to talk about the challenge of being a lifelong learner. Thanks for joining us today, Mr. Jackson.
Oh, it's my pleasure. So cool to be invited on. I love it.
Absolutely. So what the audience doesn't know is that we work together quite well on the learner side of things, and as somebody whose heart also goes pitter patter for education, I thought this would be a really fun way, as this is our holiday season episode.
Mhm.
We're going to the new year and everybody's getting kind of New Year's resolutions and thinking about how to do things. This idea of being a lifelong learner popped in my head, and I wanted to kick off this conversation with you by asking, like, why why is it important to be a lifelong learner?
Oh, so when I think of that question, one, I'm like maybe I was born into it. One of my favorite stories that my mom tells, I actually don't remember, is first day of kindergarten. I come home from kindergarten, and my mom's like, "Hey, what'd you learn today, buddy?" And I was just like, "Nothing. All we did was color." And just being disappointed with I was prepared. I guess, good parenting maybe. She prepared me for this great learning experience that was going to be kindergarten, and all we did was color. So shout out to mom. Um, but why is it important to be? Because things change. Uh, Medicine, lab medicine, life changes. That's why you gotta be ready to learn and adapt. Um, could be, all sorts of things like whether your career changes. I've had multiple careers over the course of my young life, and things have already changed. I'm relatively new to transfusion medicine. I started my career here at Mayo some 15 years ago now in the clinical chemistry lab, our big core lab. Was the last place I wanted to work at, or any lab. I did not want to do chemistry. So where did I get a job at Mayo? It was clinical chemistry. Um, and I quickly discovered I really enjoyed training. And so I kind of got more experience, tried to, volunteer whenever we had new employees or students come through, or observers or path residents, pathology residents, and just sit down and like practice it. And then when an education specialist position came up, I jumped at that and started teaching chemistry. Then
That's
just,
awesome.
yeah.
I love how you're highlighting for our listeners, right? I mean, the students that are listening can relate to this because you're talking about how to think about future proofing your career. As we all know, we might have one vision for how things go, and we get interested or different opportunities open up. I think that laboratory professionals absolutely can relate and understand how we might move through, and
Mhm.
also where we might see our career ladders. And then also clinicians could be relating to this as well about thinking about how are they future proofing as the clinical area changes. We talk about lifelong learning, and I think maybe sometimes for the student listeners, maybe it sounds a little bit kind of cliche. I think for
Absolutely.
some of us, that have been in the game a while, it's like, oh no, this is quite important. I'm curious, what do you see as the challenges to lifelong learning that just,
Mhm.
kind of are there making it a little bit difficult each day?
Yeah. Ah, I mean, it can be uncomfortable. Like, y- you don't know stuff. Like, um, and kind of if you want to understand that you need to learn something, if you think you know everything, you obviously don't. But you have to get yourself out of that Dunning-Kruger effect loop, and understand that, I don't know everything. This is an opportunity to learn. Yeah, our example that kind of came up this week in our morning conference, we're going through our patient lists and everything and talking about how these patients are doing and some different testing methodologies because things are coming from different work units and what that means. And then, we're having the learners draw it on the board for us. And I'm like, yeah, yeah. And we're kind of adding in our 2 cents. And we had it wrong. And thankfully, we had a polite and learned colleague in our midst. Shout out to Corey Dulek. And he was like, you guys, like he gently approached us. I think you guys have that wrong. I think this is a common misconception. And he righted us on it. It was beautiful. And then to your credit, you latched onto it. It's like, oh, we got to learn this. Like, what parts of this are different? I immediately, like right after that meeting was up, ran to the lab that performs that testing, said, show me the instrument, show me what's going on here. I gotta know this. Like it was a little gift to me yesterday that I got to go run in there, talk to the education specialist in the lab that I knew was a subject matter expert. And she explained it to me. She pointed it out. I took some pictures. I ran back to the other people that were in the room with us. I was like, guys, this is how it works. I may have uh, downloaded like the package insert and the FDA 501 clearance for the for the instrument to like, wait, how does it shake the plate and all sorts of, yeah. It was a great
I
fun
think our audience can understand and appreciate why I asked you to come and record this podcast, right?
time.
Because one of the things I want to kind of bring out into the open, right? You brought up the idea of the challenge can be uncomfortable,
Absolutely.
and certainly I think a lot of listeners can be like, wow, if I was in a diverse meeting and talking about something, and somebody said that actually I was completely wrong. And in that case, right, I was talking about something in completely the opposite of how what the
Yeah,
truth was.
me
You
too.
that might make people turn red in the face, feel very embarrassed. But like you're saying, you like grabbed onto that and took it to a wonderful place,
Mhm,
right? Like, what's that magic trick that you do of like, it's
mhm,
not about you getting embarrassed, it's about, oh, here's a gap
mhm.
and I'm gonna run with this, because it feels like
Yeah,
that's part of the skill somehow for a lifelong learner, because I think gaps
yeah.
come up for many of us, and sometimes it might be like, and I don't know if it comes from education where you're getting evaluated and you're like, oh, I don't want them to see that gap. um, can you elaborate on like
Yeah.
kind of how you take that in a positive light as opposed to a common challenge of being very embarrassed?
Mm. I mean, there's a bit of embarrassment that's always going to be there. I really think it may be something I'm born with, but nature versus nurture kind of always leading on itself. I think I have really have always loved curiosity and love science and exploration. Um, and I try to instill that in my child, ask
Mm,
questions. Um, you know, I'm gonna learn something every day, whether I want to or not. You might as well enjoy it. Uh, it's definitely, I think interacting with people too really helps. It's fun for me to go talk to somebody and learn something. Um,
that actually sparks a thought in my mind in that, yeah, as I kind of I think most of my kind of times where I've realized that I have a gap, it's been when I'm with people.
mhm,
Versus, I don't know, maybe I have a maybe that's being human in that when I'm by myself working on something, I'm not really catching my assumptions that I'm making, as well
Yeah,
as, when I'm interacting with colleagues.
absolutely. Nobody's there to challenge you or even kind of reflect on the idea and say like, well, couldn't it be this way? I know you said it this way, but is it always that way? Well, maybe I'm wrong. Maybe maybe there are some exceptions to these rules. I do like to embrace the gray area. I really shy away from teaching anything as a dichotomy. And so, whenever I teach, it's probably frustrating to some learners that like I say, hey, this is the way it is almost all the time. It's always X or Y, but guess what? Z is out there, and maybe we know about Z and it's just really rare, or maybe we don't know anything about Z, and there's QRS and they're way out there and they're not even in our brains yet. And in 5 years, somebody will discover that and we'll be like, oh, wow, paradigm shift. Let's think about new stuff.
I'm glad you brought up that example, uh, because I think again for our listeners, in medicine, like you bring up, it is a lot of shades of gray. There's been articles written about the skill of working with uncertainty, and
Mm,
just how that is a something that is generally woven into the fabric of healthcare. Can you, and as
mm,
somebody who knows, your scores from your learners are very high. I think it's fair to say, you almost have a following of students that have come through and worked with you, Bob. Like, can you kind of share, like, how do you talk about that grade? Because, like you say, learners who are just first learning these concepts, whether it's immunohematology, clinical chemistry, right? Like, when somebody's just
mhm,
getting their arms around it, it seems like, you know, that's the goal is, and I think a lot of us maybe listening to this podcast, myself included in some ways, like we realize the gray, but because we're dealing with a learner, we might be like, okay,
yeah,
X, Y, black, white. But
it it
how do you
is.
introduce the
Yeah,
gray?
that is a very good one. It I really I put it right there at the front, which is definitely I think probably is frustrating to some learners. They're like, Bob, I don't want to know about the extraneous weird stuff or whatever. Um, there's a lot of mosts and probablys and offens and only occasionally and rares that come into my voice or into my speaking. I always avoid never and never say always. Um, and so I really do try to present things though as dichotomous or in good buckets of like known and these are the things you need to know, and hey, we're going to ask you this on an exam or you're going to see this scenario pop out in real life. So be ready to think about these different things that you need to do, but sometimes there's going to be a weird one where it's not X or Y, it's Z, and you had to be thinking about it. And so just always, you know, come back to the fact that Z's are out there. They're going to come by.
One of the things that I struggle with specifically with that, and maybe this is our plight in pathology. Sometimes I get, I don't know if it's the right way to say it, is too curious about
Mhm.
the learner's question about the exception to the rule. And I have, on occasion, been known to go out in left field with them. Maybe more so than is really helpful for somebody that's
Mm.
learning the how do you catch yourself,
Oh, yeah.
before like totally nerding out, or how do you do that, kind of bringing somebody back to be like, yeah, it's very interesting, but what you really need to focus on right now.
Mm. I'm definitely guilty of the same sin. Of hey, let's go down that rabbit hole and chase it until we find another world.
And I only
Um,
ask because I'm really working on this in myself, is kind of catching and realizing, it's like we want to introduce that shade of gray, but we
yeah,
also can't get distracted. That's not the main
yeah,
show.
yeah, absolutely. So what's coming up in my brain is clinical chemistry stuff. It's where I've spent
Hmm.
most of my adult life. And it's probably like weird interferences with different tests. Um, those are always really cool, and like a clinical story that will always capture somebody's imagination. And so, that I bring those up a lot, but then I do have to be careful about like, well, all these things can interfere with this assay, and that's why we got this crazy result on this patient, and they were misdiagnosed or treated inappropriately. There are all these other things, and let's find all the compounds that also behave that same way. Well, you know, uh, maybe let's tamp it down. Just kind of look at um, the things that cause the most common interferences. And just store that one weird one back in your mind. Save that picture from your cell phone of that weird colored sample, and put it on your computer to talk about as a fun story. But you don't have to talk about all the crazy interferences. But it's definitely a very tough challenge for me, to pare back all those rabbit holes.
Right. I think it's maybe there's a little bit of an honesty in this conversation about like being a lifelong learner. There's some of these things like curiosity is kind of probably a skill that we can cultivate, and to some extent, if we go to an extreme with it, it can get in the way of other things. So maybe there's a bit of an
Absolutely.
honesty of moderation that comes out, or that I'm hearing in this
Yeah.
conversation. What do you think, as we got our listeners here, and students, clinicians, laboratory professionals, uh, what are your thoughts on how we can help or coach learners to become lifelong learners? And maybe that's a little bit, for ourselves as we're going into the new year. I'm looking for, and how can we kind of spark these thoughts in our listeners? How do you kind of help learners become lifelong learners?
Yeah. So I think definitely at the very beginning of connecting with this person and learning with them, is let them know that you're learning too.
Mm,
They're learning, but I'm also learning while I'm teaching, and all these little things that once I've taught it, it like sticks with me, and have them teach you something. So one of the fun things that I do, or I think it's fun, is like I get learners from all over the country and all over the world. And so like oftentimes, so my current pathology resident that I'm training in, she is from Turkey, and my next door neighbors in here are also Turkish. And so I've always dabbled like in Turkish language. I have my little Duolingo app on my phone and play with Turkish. And I'd actually set it down a long time ago, but when I got this path resident, I picked it back up and I was like, oh, this is another opportunity to practice Turkish. And so I'm like, hey, Dr. Oskan, show me some Turkish here. How would you use this phrase? And she gets these little opportunities to connect her culture, and she gets to teach me things. It's easy enough with learners too to like, what are your interests? And I'm teaching you this transfusion medicine stuff, um, but oh, that kind of anatomic pathology is really interesting to you. Show me something about it. and just let them know that like we're all in this together, we're all learning. Having the safe space that like in our morning conference, that I think you're very skilled at keeping that environment safe and allowing everybody to ask questions, and even, you know, even if they're a dumb question, allowing them to ask those, and let's go explore those. Like, um, we don't we have to do some work in morning conference, but also we can push it aside. We can get that done, after lunch, and let's go explore this new avenue of curiosity. Uh, let them do that.
Yeah, yeah. Um, have you? I'm thinking about when we've kind of over or run into struggles where somebody is maybe. I think about, and to be fair, I'm probably over generalizing, but if you were to have a learner who is just like about getting the work done, right? And like,
Mm.
they're really good at that,
Hmm.
right? I can think about learners like that where they are phenomenal about getting the work done, but sometimes I can be worried about like, are they uh, really kind of practicing and developing this skill of lifelong learning? Because I see them, they're just boom, boom,
Mm.
boom. How do you kind of approach that?
Mm.
How do you help that
Yeah.
person kind of see that, hey, there's value in maybe taking more time in particular areas?
Yeah.
Have you come
Oh,
across that?
I have come across that, and I'm trying to, you know, with our kind of career where we are, a lot of times we're preparing people for board exams. And so, yeah, I know you're not gonna be a transfusion medicine doc. Or yeah, I know medical lab students, you're not gonna work in the transfusion lab. But hey, this is gonna be on your boards. It's an easy cop out solution. Like, uh, you know, that's why we're teaching this. We want you to really succeed at these sort of things. Let them know that, life does change. You may not work in a transfusion medicine lab right after you graduate, and you may work in a microbiology lab for 5 or 10 years, but then the opportunity comes where, oh yeah, now you're going to have to change your positioning to know transfusion medicine and be able to practice it. So kind of, it doesn't work just only like with lab or clinical practice, or, your specialty in pathology. It's life. I'm from Alabama, grew up there. I, thought I was going to be a roadie for a band for after high school. That fell through. And so I found myself working construction in Alabama in the summer, and was like, I need an education. um, this is this is not okay. Uh, and then, from there are just all these different little changes and shifts to like, well, I thought I was going to do computer science in school, and so I did that for a while. And then, oh no, I fell back in love with biology and science, kind of traditional science, and so thought I was going to go that way. My wife needed to change careers and jobs, so no, had to change schools. And then I just kind of found myself in lab science. So let learners know that things change. Um, you're gonna have to adapt whether you want to or not. So enjoy it, love it.
Yeah, I hear two things in your answer. One part is kind of highlighting as, if somebody is not kind of taking the opportunity of what's coming across the workload, kind of highlighting what is the relevance? Why is this important? You have to connect that for them. And I also hear you really kind of connecting us to the top of this podcast again about the why this skill is important. For this lifelong learning of, we're not sure how our careers are going to progress, and honestly maybe one of the fun things in life are those unexpected
Mm.
changes that bring all of us together.
Absolutely.
All right, I'm
Yeah.
gonna put you on the spot here to
Mhm.
close out, Bob. Uh, do you have New Year's resolutions you're thinking about in your mind?
I'm not a big New Year's resolution kind of guy.
Okay,
I'm always evolving. Oh,
right on. All right.
always changing. Um,
Maybe could you
you know,
I was hearing about people not having New Year's resolutions but have quarterly quests.
oh yeah,
What are you
nice.
kind of kick off for the new year? What are you looking forward to in 2025?
There's a big project that's been hanging over my head that for the last like 3 years, that if I do not get done within the first quarter, I just of 2025, I'm gonna, I don't know, I'll just have to like quit my job and go work at a gas station or something. Like I just gotta do it. So yeah, I'm buckling down after Christmas. Then I'm buckling down. And that
All right.
project has got to do
Well, I'm bringing you back for that podcast conversation in the future
it.
because that's another interesting challenge is how can we work on long-term projects when
Nice.
there's so many short-term things that come up in life.
Absolutely.
We've been rounding with Mr. Bob Jackson, discussing the critical skill of lifelong learning. Thanks for taking the time with us today, Bob.
Absolutely. It's my pleasure.
And to all of our listeners, thank you for joining us today. We invite you to share your thoughts and suggestions by email to mcleducation@mayo.edu. If you've enjoyed this podcast, please subscribe. And until our next rounds together, we encourage you to continue to connect lab medicine and the clinical practice through educational conversations.